Welcome back to Dr. Gilbert Healthy Aging. I am Dr. Gilbert. Today, we are going to explore a fundamental, deeply embedded aspect of your daily life that you probably haven't thought about or analyzed in years. I want you to take a brief moment right now, close your eyes, and visualize the last time you stood up from your comfortable living room chair, walked down your hallway, or stepped outside onto the concrete driveway to check the morning mail. When you performed that seemingly simple action, did you consciously think about how you were walking? Did you meticulously plan which specific part of your foot would touch the floor first, or how high your knee needed to lift to clear the carpet? Of course you didn't. Walking is an automated neural program. It is an intricate, mechanical sequence that our brains learn through trial and error in infancy, and then bury deep within our subconscious mind forever. But as a physician who has spent decades analyzing human movement, treating joint degeneration, studying human biomechanics, and operating on senior patients, I must share a profound, unsettling, and shocking medical truth with you today. The automated, unthinking way you are walking right now, after crossing the milestone of age 70, could be a silent, escalating threat to your very survival. Let us discuss an unsettling, heavy realization that many aging adults face entirely alone, trapped in a room of quiet anxiety. Have you noticed that over the last few years, your daily walk has lost its fluid, effortless snap? Do you find yourself naturally tilting your head down, keeping your eyes completely glued to the carpet, the rug, or the pavement to make absolutely sure you don't step on an uneven edge? Have you noticed that your steps have become shorter, heavier, more laborious, and that the bottoms of your shoes are making a soft, continuous, scraping sound against the floor as you move from the bedroom to the kitchen? In the clinical world of geriatrics, a change in your gait, the mechanical, neurological pattern of your walk, is one of the earliest, most sensitive, and most accurate warning signs of severe neurological and musculoskeletal decline. When you begin to drag, scrape, or shuffle your feet across the earth, you are not just experiencing a superficial cosmetic issue of old age. You are drastically, dangerously altering the laws of physics inside your body, and you are creating a toxic biological environment that actively invites a catastrophic, life-altering fall. And for someone over the age of 70, a severe fall is never just a painful injury. It is a profound clinical event that breaks your life into two distinct halves: the independent, proud life you love, and a restricted life confined to a hospital bed, a nursing home, or a wheelchair. When you bring up your walking difficulties, your knee stiffness, or your instability to standard modern medicine, the response you receive is often incredibly passive, defeatist, and uninspired. You are told, well, you have some osteoarthritis in your knees, your spine has normal degenerative disc disease, and you are over 70 now. What do you expect? It's time to slow down, accept your limitations, stop moving so much, and here is a prescription for an aluminum cane or a heavy rolling metal walker. But as a doctor, I must look you directly in the eye and tell you that giving an aging adult a walking aid without explaining why their gait is failing in the first place is a profound medical failure. It is like putting a wooden crutch under a leaning, decaying skyscraper without fixing the structural foundation beneath the soil. It masks the visible decline for a short time while the internal structures continue to weaken and rot away every single day. I did not create this comprehensive, 7,000-word mega masterclass to leave you feeling helpless, fearful, or discouraged. Fear is an unhelpful emotion that paralyzes human potential. Quite the opposite. Today, I am going to reveal one remarkably simple, highly concentrated, and mechanically brilliant change to how you take a single step. This adjustment requires absolutely no gym memberships, no heavy weights, no painful stretches, and no extra cardiovascular stamina. It is a simple, mechanical switch that you can implement the very next time you stand up from your chair. Yet, by making this single change today, you can instantly double your stability, significantly reduce chronic knee and back pain, flush your lower limbs with circulation, and practically protect your independent longevity for decades to come. If you are truly ready to stop shuffling, stop clutching at furniture, and walk through this world with the pride, dignity, and laser-focused stability of your youth, turn off all background noise and distractions right now. Focus your mind, and let us break down this anatomical knowledge together. Before we uncover the exact, life-saving mechanics of this walking technique, take a brief moment to click that subscribe button and turn on the notification bell. By doing so, you join our global healthy aging family and ensure you are always equipped with the real, unfiltered clinical truths needed to protect your sovereign physical freedom. Let us begin by uncovering the hidden anatomical trap that destroys your everyday stride. To fix a complex machine that is losing its mechanical efficiency and drifting off course, an engineer must understand the fundamental laws of physics that govern its movement. Human walking is an extraordinary, highly coordinated mechanical process called bipedal locomotion. It is essentially a controlled forward fall, where your body weight shifts onto one leg, falls forward into gravity, and is caught by the opposite leg just in time. To perform this action safely, your central nervous system, your joints, and your muscles must work in perfect, high-speed synchronization. However, as we cross the biological threshold of age 70, a defensive, primitive survival program kicks in inside our brains. Because our vision blurs slightly, our inner ear gyroscope slows down, and we naturally lose muscle tissue. The brain develops a deep, subconscious fear of the floor. It becomes terrified of falling. To minimize this perceived danger, the brain alters your automated gait pattern. It commands your body to stop lifting your feet completely off the ground. It tells your legs to stay close to the floor, thinking that if you stay close to the earth, you cannot fall hard. This creates the highly destructive habit that I call the senior shuffle. Let us look at the mechanical disaster that occurs inside your joints when you shuffle your feet. When you walk normally, there is a clear, open clearance space between the bottom of your shoe and the carpet or pavement. But when you shuffle, that clearance drops to less than a fraction of an inch. Your shoe literally slides and drags across the floor. This means that a tiny, unnoticeable wrinkle in your living room rug, a small crack in the concrete sidewalk, a loose electrical cord, or a slightly raised wooden doorway threshold becomes a deadly trap. Your foot catches abruptly on the obstacle, your upper body momentum carries you forward, and because your neurological reflexes are delayed after 70, you hit the ground before your arms can even deploy to protect your head. Shuffling makes a fall mathematically inevitable over time. But the danger of the senior shuffle goes far deeper than just tripping over obstacles. It fundamentally changes how kinetic impact forces travel through your skeletal system. When you shuffle, your foot lands completely flat on the floor, or worse, your toes strike the ground first. This is called a flat foot strike. When a flat foot slams onto a hard surface like tile, hardwood, or concrete, it completely bypasses the body's natural shock absorption mechanisms. A massive wave of mechanical kinetic impact force travels instantly straight up your skeletal chain. It hammers into your ankle joint, shoots up your shin bone, slams into your arthritic knee cartilage, vibrates through your hip socket, and compresses the delicate discs in your lower back. This constant, daily hammering occurs 3,000 to 5,000 times a day. It causes severe, chronic pain. When you walk, your knees ache, your hips burn, and your lower back locks up into painful spasms. Because walking causes physical pain, your brain tells you to move less. You choose to sit in your recliner more often. Your muscles shrink even faster, your gait becomes even shorter and more unstable, and you enter that tragic downward spiral toward complete loss of mobility. Furthermore, when you shuffle, you turn off the primary circulatory pump in your lower body, the calf muscle pump. Your calf muscles are designed to contract deeply with every single step you take, acting as a peripheral heart. This squeezing action compresses the deep veins inside your legs, forcing deoxygenated blood and pooled fluids all the way back up to your heart against the heavy pull of gravity. When you slide your feet flatly across the floor, your calf muscles barely contract. They stay semi-dormant. Because your lower body circulatory pump is turned off, blood stagnates in your lower extremities. Your feet become chronically cold, numb, swollen, and purple. And because they are numb, your brain loses the vital sensory feedback it needs to feel where the floor is. Can you see how a simple, subconscious change in how you walk can completely decay your entire health architecture? Shuffling destroys your balance, tears down your joint cartilage, shuts off your circulation, and leaves you completely vulnerable to a life-shattering fall. To reverse this structural decay, we must bypass the brain's fearful programming and implement a single, mechanical change that instantly restores your body's brilliant engineering design. Before I reveal the exact mechanical adjustment to your step, we must dissect a profound psychological and postural mistake that almost every senior over 70 commits while walking. It is a habit driven entirely by the fear of falling, but it actually multiplies your risk of an accident by a factor of 10. I call this the cognitive blackout of looking down. When you feel unsteady on your feet, your brain panics and searches for data to help stabilize your body. Because the nerve receptors in your feet are numb from wearing thick shoes and your inner ear gyroscope has an age-related lag, your brain switches to its most powerful sensory organ, your eyes. Your brain commands you to look straight down at the floor, directly in front of your toes. You tell yourself, if I watch every single inch of the ground, I will see the obstacles, I will see the cracks, and I will be safe. But from a neurological and biomechanical standpoint, staring at your feet while walking is an absolute disaster. To understand why, we must look at how the human brain calculates balance. As we discussed in our Balance Masterclass, your visual system acts as your body's primary leveler. To know if you are standing upright or leaning over, your brain must track the stable horizon line and the vertical lines of doors and walls. The moment you tilt your head down to look at your shoes, you completely erase the horizon line from your vision. You take away the brain's primary stabilizing markers. Your brain enters a state of sensory confusion. It is trying to navigate through space while looking at a moving, shifting surface, your own feet. Furthermore, dropping your heavy head forward completely alters your physical center of gravity. The human head weighs approximately 10 to 12 pounds. When you hold your head upright, that weight sits perfectly on top of your cervical spine, aligned with your hips, your knees, and your ankles. But when you tilt your head down at a 45-degree angle to watch your feet, the laws of leverage change. That 10-pound head suddenly places a structural strain of nearly 40 pounds on the delicate muscles and ligaments of your neck and upper back. This shifts your entire center of gravity forward, pulling your torso over your toes. You are now structurally leaning into a fall. Your body is top-heavy, and your brain has to work twice as hard to keep you from falling forward. Finally, dropping your chin forward compresses the temporal bone structures inside your skull, altering the fluid dynamics of your vestibular system, your inner ear canals. Your internal gyroscope becomes completely uncalibrated. When you walk with your eyes locked onto your shoes, you have effectively turned off your visual leveler, thrown your center of gravity forward, and uncalibrated your inner ear. You are walking in a state of neurological blackout. If your foot hits a small bump, your brain cannot process the data fast enough to save you. To walk straight, to walk safe, and to protect your life, your chin must stay up, your eyes must look at the horizon, and your feet must learn to navigate through space using a different mechanical trigger. Now, let us move away from the anatomy of the decline and focus 100% of our cognitive energy on the practical solution. I am going to teach you the single most powerful mechanical adjustment you can make to your walking technique today. This is the exact training protocol I use with my senior patients to eliminate the senior shuffle and instantly restore physical stability. This technique is known in biomechanics as the heel-to-toe strike. When you shuffle, your foot moves horizontally like a flat board sliding across ice. The change I want you to make today is a complete reprogramming of how your foot makes contact with the earth. I want you to consciously ensure that the very back portion of your heel is the first part of your body to touch the ground with every single step you take. Let us break this movement down into 3 precise mechanical phases. I want you to stand up right now, place one hand on a sturdy chair, counter, or wall for safety, and practice these steps with me with absolute focus. Phase 1. The heel lead, the ankle cock. The first phase happens before your foot even touches the floor. It is an preparatory movement. When you take a step forward with your right leg, I want you to actively, consciously pull your toes up toward the sky. In medicine, we call this movement dorsiflexion. You are cocking your ankle joint. How to perform it perfectly. 1. Stand tall, hold onto your chair for safety, and look straight ahead at the wall. Do not look down. 2. Lift your right leg forward to take a normal step. 3. As the leg moves forward, contract the muscles on the front of your shin, the anterior tibialis, and pull your right toes up as high as comfortable. 4. By cocking your ankle, you ensure that your heel is angled downward, making it physically impossible for your flat foot or your toes to slide or drag across the carpet. 5. Extend your leg until the very back edge of your heel makes a firm, distinct contact with the floor. Phase 2. The rolling vascular compression. The second phase is the transition of your body weight. Once your heel makes solid contact with the floor, do not just slam the rest of your foot down flat. I want you to execute a smooth, rolling transition. How to perform it perfectly. 1. As your heel touches the ground, slowly roll your body weight forward along the outer arch of your foot. 2. Imagine your foot is the rocking base of a beautiful rocking chair. It should be a continuous, fluid rolling movement from the back to the front. 3. As your foot rolls forward, let the ball of your foot make contact. And finally, let all 10 of your toes flatten and grip the floor. 4. During this rolling phase, your knee will naturally bend slightly to absorb the impact force, preventing the shock wave from traveling up into your joints. Phase 3. The big toe launch, the power push. The final phase is where we generate forward power and completely activate your lower body circulatory pump. This is the big toe launch. How to perform it perfectly. 1. As your body weight travels over the front of your right foot, don't just lift your foot up to take the next step. 2. I want you to actively press your big toe and the ball of your foot down into the floor, pushing the earth away behind you. 3. This downward push forces your deep calf muscles to contract with immense strength. 4. This muscular contraction flushes the veins in your leg with blood while simultaneously rocketing your body forward with clean, horizontal momentum, making room for your left leg to swing forward and execute its own heel strike. Why this one change saves your life. Let us look at the beautiful structural transformation that occurs inside your body the moment you walk with a heel-to-toe strike. First, by pulling your toes up in phase 1, you automatically force your knee to lift higher off the ground. Your foot clearance instantly increases by nearly 2 inches. You are no longer dragging your shoes. You will cleanly, safely step right over rugs, doorway thresholds, and cracks in the sidewalk. You have effectively removed the physical trigger for trips and falls. Second, your heel bone, the calcaneus, is engineered by nature to absorb massive impact forces. It is surrounded by a thick, specialized pad of fatty tissue designed to dampen shock. When you land heel first, this fat pad absorbs 80% of the kinetic impact force. Your arthritic knees, your degenerated hip sockets, and your compressed lower back discs are completely protected from the daily hammering of walking. Your walking pain will begin to diminish because your body's natural shock absorbers are back online. Third, by pushing off with your big toe in phase 3, you are turning your peripheral heart back on. Your calf muscles contract deeply 3,000 times a day. Fresh, oxygenated blood floods your legs, warming your cold toes, reversing chronic numbness, and flooding your brain with real-time proprioceptive data. Your brain can finally feel the floor clearly again, giving you an immediate boost to your global stability. Now that you understand the mechanics of the heel-to-toe strike, we must design a practical retraining program to turn this technique into an automatic, subconscious habit. At age 70 or 80, your brain requires consistent, intentional practice to overwrite decades of poor walking habits. To achieve this, I prescribe a simple, daily 5-minute intentional walk to all my senior patients. You do not need to go outside, and you do not need to walk fast. Every single afternoon, after lunch or before dinner, I want you to spend exactly 5 minutes walking back and forth down the longest hallway or room inside your house. While you walk during these 5 minutes, turn off the television, put away your phone, and focus 100% of your cognitive attention on your feet. As you take every single step, mentally repeat this 3-word mantra like a metronome. Heel, roll, toe. Heel, roll, toe. Walk slowly. Feel the heel make contact. Feel the foot roll forward, and feel the big toe push the floor away. Within 14 days of daily consistency, your brain's motor cortex will build a permanent new neural network, and the heel-to-toe strike will become your new automatic walking style without you ever having to think about it again. However, during your daily practice, you must be hypervigilant to avoid these 4 common mechanical errors that seniors often make. Error #1, the giant stride, overstriding. When seniors are told to land heel first, they often think they need to take massive, giant steps forward. This is a severe mechanical mistake. When you take a stride that is too long, your heel lands too far in front of your body center, locking your knee joint completely straight. This acts as a physical brake, killing your forward momentum and putting extreme stress on your hip sockets. Keep your steps short, natural, and comfortable. The length of your step does not change, only the angle of your foot changes. Error #2, the downward gaze. As we analyzed in Chapter 3, looking down at your shoes destroys your visual anchor and throws your center of gravity forward. When practicing your heel-to-toe walk, you must keep your chin up, parallel to the floor, and anchor your eyes onto the wall at the end of the hallway. Trust your feet. Your feet know how to navigate space through touch. You do not need to watch them with your eyes. Error #3, the loose house slipper. You cannot practice a proper heel-to-toe strike if you are wearing loose, backless house slippers, flip-flops, or slip-on shoes. Because these shoes have no secure heel counter, your toes are forced to unconsciously curl up and grip the sole of the shoe to keep it from flying off with every step. This tension freezes your ankle joint and makes a rolling transition impossible. Always practice in a supportive lace-up sneaker or securely fastened shoe that locks your heel in place. Error #4, the breath hold, the Valsalva stiffening. When concentrating deeply on your feet, you might find yourself unconsciously holding your breath, tensing your jaw, and locking your shoulders tight. This creates systemic muscular rigidity and spikes your blood pressure. Relax your upper body. Let your arms swing gently and naturally by your sides. Your arms act as counterweights to your legs. Their movement stabilizes your spine and coordinates your walking rhythm. My dear friends, as we bring this ultimate walking masterclass to a close, I want to share a deeply personal message with you. Reaching your 70s, 80s, or 90s is not a tragedy to be feared, nor is it a medical sentence for physical obsolescence. It is a monumental victory. You are a survivor of a long, beautiful, and complex human journey. You carry within your mind decades of wisdom, memories, and love. You have spent your entire existence serving others, building families, and protecting your communities. You have earned the absolute right to live this golden season of your life with uncompromised dignity, with your chin held high, and with the proud physical autonomy to move through this world entirely on your own terms. Losing your stability, shuffling your feet across the floor, or living in constant fear of a fall is not an organic, inevitable consequence of getting old. It is simply a mechanical breakdown, a broken software code in your brain, and an uncalibrated step in your stride. And as we have discovered together today, even the most stubborn mechanical failures can be completely reversed through a single, intelligent, and focused adjustment. Do not allow the passive attitudes of modern medicine to dictate the boundaries of your world. Do not accept a life that slowly shrinks into a single room or a single chair. Your central nervous system remains highly intelligent, profoundly adaptive, and ready to heal until the final breath you draw. You do not lack the capacity to walk with strength. You simply lack the right blueprint. Now today, you possess that blueprint. I challenge you right now, as your doctor. The moment this video finishes and the screen goes quiet, do not just sit there. Stand up from your chair. Hold on to a stable surface. Lift your chin up. Align your head with the horizon. Step forward with your right leg. Cock your ankle, and drive your heel firmly into the floor. Roll to your toes and launch your body forward. Send the immediate, powerful signal to your nervous system that you are ready to stay strong, ready to protect your longevity, and ready to reclaim your life. If today's masterclass brought a sense of hope and power back into your life, please do not keep it to yourself. Share this video immediately with your spouse, your siblings, your friends at the bowls club, or anyone you know who is currently shuffling through their days in fear. Let us eradicate the shame of balance loss and protect the independence of our seniors together. Thank you for your time, your trust, and for opening your heart to me today. Remember to click that subscribe button to join our Dr. Gilbert Healthy Aging family. Walk with mindfulness. Execute your daily heel strike, and I will see you in our very next episode. Stay strong, walk with absolute pride, and live every single day to its sovereign fullest.